101. Which of the following is a primary symptom of Parkinson's disease? A. Sudden weight gain. B. Involuntary movements, chorea. C. Muscle rigidity and bradykinesia, slow movement. D. Vision loss. Answer: C. Muscle rigidity and bradykinesia, slow movement. Rationale: muscle rigidity and bradykinesia are classic symptoms of Parkinson's disease. Chorea, involuntary movements, is more common in Huntington's disease, and vision loss is not a primary symptom of Parkinson's. 102. Which of the following treatments is commonly used for Parkinson's disease? A. Levodopa. B. Insulin therapy. C. Vitamin D supplements. D. Acupuncture. Answer: A. Levodopa. Rationale: levodopa is commonly used to treat Parkinson's disease by increasing dopamine levels in the brain. Insulin therapy, vitamin D supplements, and acupuncture are not standard treatments for Parkinson's. 103. Which of the following is the hallmark pathological feature of Parkinson's disease? A. Amyloid plaques. B. Lewy bodies. C. Tangles of tau protein. D. Genetic mutation in the HTT gene. Answer: B. Lewy bodies. Rationale: Lewy bodies, which are abnormal protein deposits in brain cells, are a hallmark pathological feature of Parkinson's disease. Amyloid plaques and tau tangles are associated with Alzheimer's disease, while the HTT gene mutation is associated with Huntington's disease. 104. Which of the following is the most common cause of dementia in older adults? A. Huntington's disease. B. Alzheimer's disease. C. Traumatic brain injury. D. Stroke. Answer: B. Alzheimer's disease. Rationale: Alzheimer's disease is the most common cause of dementia in older adults, accounting for approximately 60 to 70% of cases. Huntington's disease is less common, and while stroke and traumatic brain injury can lead to dementia, they are not the most common causes. 105. Which of the following is typically observed in the early stages of Alzheimer's disease? A. Severe memory loss. B. Difficulty with balance and coordination. C. Short-term memory loss and confusion. D. Loss of appetite. Answer: C. Short-term memory loss and confusion. Rationale: in the early stages of Alzheimer's disease, individuals often experience short-term memory loss and confusion. Severe memory loss, balance issues, and loss of appetite are typically observed in the later stages. 106. Which of the following is a key feature of frontotemporal dementia, FTD? A. Memory loss is the primary symptom. B. Personality and behavior changes. C. Sudden onset of motor paralysis. D. Visual hallucinations. Answer: B. Personality and behavior changes. Rationale: frontotemporal dementia is primarily characterized by changes in personality, behavior, and social conduct, rather than memory loss. Motor paralysis and visual hallucinations are not common features of FTD. 107. What is the main difference between vascular dementia and Alzheimer's disease? A. Vascular dementia is caused by damage to blood vessels in the brain. B. Alzheimer's disease is reversible, but vascular dementia is not. C. Vascular dementia affects memory, while Alzheimer's affects personality. D. Alzheimer's disease progresses more rapidly than vascular dementia. Answer: A. Vascular dementia is caused by damage to blood vessels in the brain. Rationale: vascular dementia is caused by reduced blood flow to the brain due to stroke or other vascular conditions. Alzheimer's disease, on the other hand, is a neurodegenerative disease. 108. Which of the following is a typical early sign of vascular dementia? A. Sudden memory loss. B. Difficulty with movement and coordination. C. Difficulty planning and organizing. D. Sudden onset of speech issues. Answer: C. Difficulty planning and organizing. Rationale: vascular dementia often presents with difficulty planning and organizing, as well as problems with attention and problem-solving. Sudden memory loss, speech issues, and movement difficulties can occur later. 109. Which of the following neurotransmitters is most commonly associated with Parkinson's disease? A. Serotonin. B. Acetylcholine. C. Dopamine. D. Glutamate. Answer: C. Dopamine. Rationale: Parkinson's disease is primarily associated with a loss of dopamine-producing neurons in the brain. Serotonin, acetylcholine, and glutamate are involved in other neurological conditions. 110. Which of the following is an early symptom of multiple sclerosis, MS? A. Difficulty swallowing. B. Visual disturbances or blurred vision. C. Memory loss. D. Uncontrollable tremors. Answer: B. Visual disturbances or blurred vision. Rationale: Visual disturbances, such as blurred or double vision, are often one of the earliest symptoms of multiple sclerosis. Difficulty swallowing, memory loss, and tremors typically appear in later stages. 111. Which of the following conditions is commonly associated with autoimmune attacks on the central nervous system? A. Guillain-Barré syndrome. B. Multiple sclerosis. C. Amyotrophic lateral sclerosis. D. Huntington's disease. Answer: B. Multiple sclerosis. Rationale: Multiple sclerosis is an autoimmune condition in which the immune system attacks the central nervous system, leading to damage of the myelin sheath. Guillain-Barré syndrome also involves an autoimmune attack, but it typically affects peripheral nerves. 112. Which of the following symptoms is commonly associated with amyotrophic lateral sclerosis, ALS? A. Weakness in the legs and arms. B. Memory loss and confusion. C. Loss of coordination and balance. D. Muscle spasms in the face. Answer: A. Weakness in the legs and arms. Rationale: ALS is characterized by progressive muscle weakness, starting in the legs and arms, which leads to difficulty with movement, swallowing, and breathing. Memory loss and confusion are not primary symptoms. 113. Which of the following is a key feature of Huntington's disease? A. Progressive loss of muscle strength. B. Chorea, involuntary movements. C. Gradual loss of speech and vision. D. Sudden paralysis of the limbs. Answer: B. Chorea, involuntary movements. Rationale: Chorea, or involuntary jerky movements, is a hallmark symptom of Huntington's disease. Muscle weakness, paralysis, and vision loss occur in later stages, but chorea is more prominent early on. 114. Which of the following conditions is characterized by progressive motor weakness due to the loss of motor neurons? A. Huntington's disease. B. Multiple sclerosis. C. Amyotrophic lateral sclerosis. D. Alzheimer's disease. Answer: C. Amyotrophic lateral sclerosis. Rationale: Amyotrophic lateral sclerosis, ALS, is characterized by the progressive loss of motor neurons, leading to muscle weakness and atrophy. Huntington's disease and multiple sclerosis also affect movement, but have additional neurological and cognitive symptoms. 115. Which of the following is a common early symptom of Alzheimer's disease? A. Memory loss, particularly short-term memory. B. Tremors and rigid movements. C. Slurred speech and difficulty swallowing. D. Uncontrolled muscle spasms. Answer: A. Memory loss, particularly short-term memory. Rationale: Early symptoms of Alzheimer's disease typically include short-term memory loss, confusion, and difficulty with language. Tremors, slurred speech, and muscle spasms are not characteristic of Alzheimer's disease in the early stages. 116. Which of the following is a recommended treatment for patients with early-stage Alzheimer's disease? A. Cognitive behavioral therapy. B. Acupuncture. C. Medications to improve memory and cognition. D. Vitamin B12 injections. Answer: C. Medications to improve memory and cognition. Rationale: Medications such as cholinesterase inhibitors can help improve memory and cognition in the early stages of Alzheimer's disease. Cognitive behavioral therapy and acupuncture may be complementary treatments, but are not primary interventions. 117. Which of the following is a hallmark sign of Lewy body dementia? A. Memory loss. B. Hallucinations and visual disturbances. C. Paralysis of the lower limbs. D. Cognitive decline without motor symptoms. Answer: B. Hallucinations and visual disturbances. Rationale: Lewy body dementia is characterized by cognitive decline along with visual hallucinations and other psychiatric symptoms. Memory loss and paralysis are not hallmarks of Lewy body dementia. 118. Which of the following is a common side effect of the medications used to treat Parkinson's disease? A. Weight loss. B. Insomnia. C. Sleep disturbances and vivid dreams. D. Hearing loss. Answer: C. Sleep disturbances and vivid dreams. Rationale: Medications used to treat Parkinson's disease, such as dopamine agonists, can cause sleep disturbances, vivid dreams, and even hallucinations. Weight loss, insomnia, and hearing loss are not common side effects. 119. Which of the following is a common non-motor symptom of Parkinson's disease? A. Tremors. B. Cognitive impairment. C. Loss of appetite. D. Difficulty with walking. Answer: B. Cognitive impairment. Rationale: Cognitive impairment, including difficulties with memory, attention, and executive function, is a common non-motor symptom of Parkinson's disease. Tremors, appetite loss, and difficulty with walking are motor symptoms. 120. What is the typical progression of multiple sclerosis, MS? A. Rapid decline with sudden relapses. B. Gradual and steady progression without remissions. C. Relapsing and remitting episodes. D. Slow, irreversible loss of motor function. Answer: C. Relapsing and remitting episodes. Rationale: Multiple sclerosis typically follows a relapsing-remitting course, where patients experience episodes of worsening symptoms followed by periods of improvement or remission. 121. Which of the following is a typical symptom of a stroke? A. Severe headache and vision loss. B. Sudden weakness or numbness on one side of the body. C. Abdominal pain and bloating. D. Persistent cough. Answer: B. Sudden weakness or numbness on one side of the body. Rationale: A stroke often causes sudden weakness, numbness, or paralysis on one side of the body, along with speech difficulties. Severe headache and vision loss can occur, but are not the most common symptoms. 122. Which of the following is a common risk factor for a stroke? A. High blood pressure. B. Low cholesterol. C. Regular exercise. D. Low blood sugar levels. Answer: A. High blood pressure. Rationale: High blood pressure is a major risk factor for stroke, as it can damage blood vessels and increase the likelihood of a blockage or rupture. Low cholesterol and low blood sugar are not direct risk factors. 123. Which of the following is the most common type of stroke? A. Ischemic stroke. B. Hemorrhagic stroke. C. Transient ischemic attack, TIA. D. Brain tumor. Answer: A. Ischemic stroke. Rationale: Ischemic strokes, caused by blockages in blood vessels, account for approximately 85% of all strokes. Hemorrhagic strokes are less common, and TIAs are brief, temporary episodes of reduced blood flow. 124. Which of the following is a common symptom of a transient ischemic attack, TIA? A. Nausea and vomiting. B. Sudden weakness or numbness on one side of the body. C. Difficulty speaking or understanding speech. D. Severe headache. Answer: B. Sudden weakness or numbness on one side of the body. Rationale: TIA is often present with symptoms similar to a stroke, such as sudden weakness or numbness and difficulty speaking. However, these symptoms resolve quickly, usually within minutes to hours. 125. Which of the following treatments is commonly used for ischemic stroke? A. Antiplatelet drugs. B. Insulin therapy. C. Vitamin C supplementation. D. Corticosteroids. Answer: A. Antiplatelet drugs. Rationale: Antiplatelet drugs such as aspirin are commonly used to prevent further clot formation in ischemic stroke. Insulin therapy, vitamin C, and corticosteroids are not primary treatments for ischemic stroke. 126. Which of the following is a common complication following a stroke? A. Paralysis. B. Hypertension. C. Anemia. D. Diabetes. Answer: A. Paralysis. Rationale: Paralysis or weakness on one side of the body is a common complication following a stroke, especially with ischemic strokes. Hypertension and diabetes can increase the risk of stroke, but are not direct complications. 127. Which of the following lifestyle changes can help reduce the risk of stroke? A. Reducing alcohol consumption. B. Increasing sugar intake. C. Smoking cessation. D. Increasing saturated fat intake. Answer. A. Reducing alcohol consumption. Rationale. Reducing alcohol consumption, along with smoking cessation and a healthy diet, can significantly reduce the risk of stroke. Increasing sugar intake and saturated fat intake increase stroke risk. 128. Which of the following is a key symptom of a heart attack? A. Severe headache. B. Chest pain or discomfort. C. Sudden nausea and vomiting. D. Shortness of breath during sleep. Answer. B. Chest pain or discomfort. Rationale. Chest pain or discomfort is the hallmark symptom of a heart attack, often accompanied by other symptoms like nausea and shortness of breath. Severe headache is more common in other conditions. 129. Which of the following risk factors is most strongly associated with heart disease? A. Sedentary lifestyle. B. Low salt intake. C. Regular alcohol consumption. D. High blood sugar levels. Answer. A. Sedentary lifestyle. Rationale. A sedentary lifestyle is a major risk factor for heart disease, contributing to obesity, high blood pressure, and other health issues. High blood sugar levels and low salt intake are not as strongly correlated. 130. Which of the following medications is commonly prescribed after a heart attack? A. Anticoagulants. B. Antidepressants. C. Antibiotics. D. Statins. Answer. D. Statins. Rationale. Statins are commonly prescribed to lower cholesterol and reduce the risk of further heart attacks. Anticoagulants may be used in some cases, but statins are more common for post-heart attack care. 131. Which of the following is a primary symptom of congestive heart failure? A. Sudden weight gain. B. Swelling in the legs and feet. C. Chest pain. D. Shortness of breath. Answer. D. Shortness of breath. Rationale. Shortness of breath is a hallmark symptom of congestive heart failure, often worsened with exertion. Swelling in the legs and feet, sudden weight gain, and chest pain can occur, but shortness of breath is most common. 132. Which of the following tests is commonly used to diagnose a heart attack? A. Electrocardiogram, ECG. B. CT scan of the abdomen. C. Chest X-ray. D. Blood glucose test. Answer. A. Electrocardiogram, ECG. Rationale. An electrocardiogram, ECG, is a key test used to diagnose a heart attack by recording the electrical activity of the heart. Chest X-rays and blood glucose tests are not used to diagnose heart attacks directly. 133. Which of the following conditions is characterized by high blood pressure over a long period of time? A. Hypertension. B. Hypotension. C. Arrhythmia. D. Tachycardia. Answer. A. Hypertension. Rationale. Hypertension, or high blood pressure, is a chronic condition characterized by elevated blood pressure over time. Hypotension refers to low blood pressure, while arrhythmia and tachycardia refer to abnormal heart rhythms. 134. Which of the following is a common cause of hypotension? A. Dehydration. B. Excessive alcohol consumption. C. High sodium intake. D. High blood pressure. Answer. A. Dehydration. Rationale. Dehydration is a common cause of hypotension as it reduces blood volume. Excessive alcohol consumption and high sodium intake can lead to high blood pressure, not low. 135. Which of the following lifestyle factors can increase the risk of hypertension? A. Low salt diet. B. Regular physical activity. C. Excessive alcohol consumption. D. Increased potassium intake. Answer. C. Excessive alcohol consumption. Rationale. Excessive alcohol consumption can raise blood pressure and increase the risk of hypertension. A low-salt diet and regular physical activity typically help prevent high blood pressure. 136. Which of the following is a typical symptom of a pulmonary embolism? A. Sudden shortness of breath. B. Chest tightness and cough. C. Swelling in the legs. D. Nausea and vomiting. Answer. A. Sudden shortness of breath. Rationale. A pulmonary embolism often causes sudden shortness of breath, along with chest pain or discomfort. Swelling in the legs and nausea are not primary symptoms. 137. Which of the following is a common risk factor for developing a pulmonary embolism? A. Prolonged immobility. B. Low cholesterol. C. High blood sugar. D. Regular physical activity. Answer. A. Prolonged immobility. Rationale. Prolonged immobility, such as long periods of sitting or bed rest, increases the risk of developing a pulmonary embolism. 138. Which of the following is commonly prescribed to treat a pulmonary embolism? A. Blood thinners, anticoagulants. B. Pain relievers, NSAIDs. C. Antibiotics. D. Antidepressants. Answer. A. Blood thinners, anticoagulants. Rationale. Blood thinners or anticoagulants are used to prevent further clot formation and treat pulmonary embolism. NSAIDs and antibiotics are not typically used for this condition. 139. Which of the following is a characteristic sign of a myocardial infarction, heart attack? A. Severe, crushing chest pain. B. Pain radiating to the stomach. C. Headache and dizziness. D. Pain in the lower back. Answer. A. Severe, crushing chest pain. Rationale. Severe, crushing chest pain that may radiate to the left arm or jaw is a characteristic sign of a heart attack. 140. Which of the following is a major risk factor for developing coronary artery disease? A. High cholesterol levels. B. Low blood pressure. C. High protein diet. D. High vitamin C intake. Answer. A. High cholesterol levels. Rationale. High cholesterol levels, particularly low-density lipoprotein, LDL, cholesterol, are a major risk factor for coronary artery disease, as they can lead to plaque buildup in the arteries. 141. What is a common symptom of chronic obstructive pulmonary disease, COPD? A. Difficulty swallowing. B. Shortness of breath during exercise. C. Severe chest pain. D. Sudden weight loss. Answer. B. Shortness of breath during exercise. Rationale. Shortness of breath, especially during physical exertion, is a hallmark symptom of COPD caused by narrowed airways and difficulty expelling air. Severe chest pain, difficulty swallowing, and weight loss are not primary symptoms of COPD. 142. Which of the following is a major risk factor for COPD? A. Overuse of antibiotics. B. Smoking. C. High blood pressure. D. Excessive sugar intake. Answer. B. Smoking. Rationale. Smoking is the leading cause of COPD, as it damages the lungs and airways over time. High blood pressure, overuse of antibiotics, and excessive sugar intake are not direct risk factors for COPD. 143. Which of the following medications is commonly used to manage COPD symptoms? A. Antidepressants. B. Bronchodilators. C. Beta blockers. D. Steroids. Answer. B. Bronchodilators. Rationale. Bronchodilators are commonly prescribed to help open the airways and relieve symptoms of COPD. Steroids may be used in some cases, but antidepressants and beta blockers are not typically used for COPD management. 144. What is the primary diagnostic test for COPD? A. Electrocardiogram, ECG. B. CT scan of the abdomen. C. Pulmonary function test. D. Blood pressure measurement. Answer. C. Pulmonary function test. Rationale. Pulmonary function tests, such as spirometry, are used to diagnose COPD by assessing lung function and airflow. Blood pressure, CT scans, and ECGs are not used for COPD diagnosis. 145. Which of the following lifestyle changes is most beneficial in managing COPD? A. Increased sugar intake. B. Smoking cessation. C. decreasing fluid intake. D. Reducing physical activity. Answer: B. Smoking cessation. Rationale: smoking cessation is the most important lifestyle change for managing COPD as it prevents further damage to the lungs. Increasing sugar intake, reducing physical activity, and decreasing fluid intake can worsen COPD symptoms. 146. What is a common complication of COPD? A. Low blood sugar. B. Asthma. C. Pulmonary hypertension. D. Stroke. Answer: C. Pulmonary hypertension. Rationale: pulmonary hypertension, or high blood pressure in the lungs, is a common complication of COPD due to the increased workload on the heart. Stroke and asthma are not direct complications of COPD. 147. Which of the following is the best method for preventing the progression of COPD? A. Low-salt diet. B. Smoking cessation. C. Routine use of antibiotics. D. High-protein diet. Answer: B. Smoking cessation. Rationale: smoking cessation is the most effective way to slow the progression of COPD as it stops further damage to the lungs. Antibiotics, high-protein diets, and low-salt diets do not prevent COPD progression. 148. Which of the following is an expected finding in a person with COPD during a physical exam? A. Normal lung sounds. B. Wheezing. C. Decreased heart rate. D. Abnormal liver function. Answer: B. Wheezing. Rationale: wheezing, caused by narrowed airways, is a common finding in COPD during a physical exam. Normal lung sounds and decreased heart rate are not expected findings in COPD. Abnormal liver function is unrelated to COPD. 149. What is the primary cause of emphysema, a form of COPD? A. Infection in the lungs. B. Overuse of inhalers. C. Destruction of lung tissue. D. Fluid retention in the lungs. Answer: C. Destruction of lung tissue. Rationale: emphysema is primarily caused by the destruction of the alveolar walls in the lungs, which impairs gas exchange. Infection, fluid retention, and overuse of inhalers are not the primary causes of emphysema. 150. What is the recommended vaccine for individuals with COPD? A. MMR vaccine. B. Yellow fever vaccine. C. Influenza vaccine. D. Varicella vaccine. Answer: C. Influenza vaccine. Rationale: the influenza vaccine is recommended for individuals with COPD to prevent respiratory infections that can worsen symptoms. The MMR, varicella, and yellow fever vaccines are not specifically recommended for COPD management.